preservation or precision rhinoplasty. Welcome back to Rohrich Knows Podcast, helping you become a better and more informed you. So what's the hybrid rhinoplasty? Well, it's a hot new topic in rhinoplasty. Basically, it's combining the best of the best with preservation rhinoplasty, preserving the dorsum, with tissue shaping, which is structural or precision rhinoplasty. So dorsal preservation rhinoplasty is really excellent for preserving this part of the nose, this cartilaginous junction with the bony portion. And really, it's a finesse procedure. And it is somewhat of a misnomer because you really are taking apart a lot of the nose to preserve this part. So you got to know before you go and do it in patients that actually really have a specific indication. So patient selection is key, and understanding all of the things that it requires to prevent hump recurrence, which are called the blocking points. So I think it's an excellent technique for very specific problems. And let me share with you those specific problems. And they are 5 things. They have to have good dorsal aesthetic lines like this beautiful young lady, and have a V-shaped dorsum and a high radix, short nasal bones, a good strong septum, and not a very deviated nose because, you know, are you going to preserve a very deviated asymmetric DAL? No. And not too wide of a dorsum. So you want to avoid revision cases, patients that have really S-shaped deformities, low radix, and long nasal bones. So these are all things that you have to know. And of course, the blocking points are really important to know. In fact, I've written an article with Dr. Gotzel on this. It's in the Journal of Plastic and Reconstructive Surgery that really talks about these 8 things that you have to release to make sure that you get consistently reproducible results in rhinoplasty. So, and obviously it's beyond the scope of this podcast, but just know that these are the things that you really need to understand. It's all about anatomy, it's all about precision. So these are the favorable indications, like I mentioned, you know, short nasal bones, a V-shaped dorsum, high radix, and then the cartilage that's strong, that's fairly reasonably dorsal aesthetic lines, and that has, if it's a primarily cartilaginous dorsum, it's perfect for doing that. This is an excellent example of such a patient. You know, high septal strip, the patient has a straight nose, nice dorsal aesthetic lines, beautiful young lady, short nasal bones. So of course she had a high septal strip, which means that you took down the upper part of the nose, to septum rather, kept the dorsal component intact, did a push down, and here she is at a year post-op. She looks great. Her dorsal aesthetic lines are beautiful. She's beautiful. She's more beautiful. She has beautiful shape of her dorsum. Her tip looks great. And I think that's really, I think, an ideal indication for doing a preservation rhinoplasty. And I think that these will stand the test of time. And I think you can see that in all the views and all the angles. And here's a preservation rhinoplasty patient, again, that's ideal. She's got thin skin, she's got short nasal bone, she's got a slight dorsal hump. Dorsal aesthetic lines look pretty good. And I like that. And she is a perfect candidate, again, for what's called a high septal strip, push down, complete osteotomy, structural tip shaping, and I think that's really important. So here she is, and here she is where she's actually really just talking about her result, and I think that's really important. Here she is 2 years post-op. You can see that her nose looks awesome. It matches her beautiful face, her shape and contour is good. It's just been reshaping of her face. Because when I look at her now, I look at her beautiful eyes. And that's a sign of a great rhinoplasty because you can see it looks great. It matches her beautiful face and contour, her lips and chin, and really that's really what you want. You want the nose to match the face, and that's really what it's all about. And you can see she's radiant, she loves it, and so do I. So just to give you an example of, here she is at 6 months, 2 years. Beautiful dorsal aesthetic lines, hasn't changed. If anything, it's gotten better. 6 months, 2 years. 6 months, 6 months, 2 years. Nice tip projection, slight super tip break. Same thing, preservation of that, 2 years. Another one, different view, 6 months, 2 years. So these patients actually, when you have done the right indications, work and look beautiful. 6 months, 2 years. So can you really tell the difference between a precision structural rhinoplasty and a preservation rhinoplasty? Well, we actually looked at it in a blinded study and found out that really didn't matter. This patient had precision, this patient had preservation rhinoplasty, precision, preservation. They both look awesome, they look great. It's the technique and the technician. It's the surgeon that actually, by selecting the right patient, by selecting the right technique, and releasing all the blocking points, that's the key in rhinoplasty. It's a key in everything you do in rhinoplasty. So know before you go. So preservation rhinoplasty requires the experience and expertise of someone that understands the nose, especially the septum. So it's patient selection, good judgment, and doing it on a patient that really has reasonably good dorsal aesthetic lines. Then you can get a great result using preservation techniques and technology. And I think that's the thing you must do. But you must master structural rhinoplasty first. That's so important. So hopefully you found this to be very, very helpful. There are other Rohrich Knows podcasts that have talked about structural rhinoplasty or precision rhinoplasty. So know before you go, choose the technique, and more importantly, choose your surgeon wisely for a rhinoplasty. Until next time, leave me your comments, leave me your thoughts. Stay safe and be well informed.